Welcome to Talks with Docs. I'm Dr. Lisa Peterson, and today's topic will be on keeping kids healthy in the summer. And today's guest is Dr. Stacie Bleicher, who is a local pediatrician. Welcome, Dr. Bleicher.
Thank you, Dr. Peterson.
And first off, the most obvious thing to talk about is going to be the sun and heat and how to keep our kids safe from sun and heat. So maybe talk about sunscreen.
Sure.
Okay.
And I think, first point is it's important for parents to be a good role model for their kids. We're supposed to wear sunscreen too. Mm-hmm. And so, we want not only to prevent sunburns, but to know that we need to protect our skin from sun and share that idea with our children. It's very important for families with young infants to know that sunscreens are not to be relied on babies under 6 months of age. It's just far too easy for those children to burn and have serious burns. So what we generally recommend is that they be physically protected by the sun, whether they be under an umbrella or an awning, have as long and tight weaved clothing on as they can. If you can't shade them, you can try doing a little spot touching on places you can't cover with sunscreen, but don't count on it again.
You can use sunscreen in babies under 6 months?
It's safe to use, but it's not felt always to be predictably effective.
Okay.
And for example, in SPF 15, a baby could get a sunburn after more than 15 minutes in the sun with that strength of sunscreen if they were out for longer than 15 minutes. So it's of limited use. And I tend to just say, just don't have them out there.
Right, okay.
Then with our older kids, it's 6 months and up, it's fine to use sunscreens. They're now recommending using screens that have both UVA and UVB protection, at least SPF 15. It's not totally clear to me how much benefit there is to get over, say, 30 or 40 on your SPF factor.
Okay.
And sometimes we run into kids having skin sensitivity problems with those real high SPF products. But important points about using sunscreen, number one, you've got to put it on at least 20 to 30 minutes before the kids are going outside. It takes that long for it to soak in, to bond with the skin, so it'll be effective. So if you put it on when they first go out, it's like they've been out in the sun with no protection for 20 minutes, and they might sweat it off before it even takes effect. Okay. So that's very important. If they're going to be in a setting where there's going to be a lot of reflective sun, where there's sand, a lot of water, skiing in the winter with snow, sometimes you have to go with a higher SPF. The other thing is you have to remember to get those surfaces we don't normally think of, like under the chin and earlobes and things like that. Kids
Scalp.
that are, hats. You need some kind of cover up. It's hard to get sunscreen under your hair, under your scalp very well.
How about as far as the strength? Then you said 30. You don't have to really go
15
above.
to 30.
Okay.
Is generally going to be acceptable.
How often should you be putting that on?
Probably every 2 hours. Okay. And even our screens that say they're waterproof are, and if the kids are swimming, if you're sweating profusely, you need to reapply.
Okay. How about they have the sprays versus the cream? Is one better than the other?
I think some families feel that the kids are more compliant with letting them apply the sprays, and if that's the case, I have not heard problems with it. Most of my families have been pretty successful with that.
Okay. I don't know if you can get it on better with it or not. To me, it looks like a lot of it's wasted.
Yeah, I'm sure some of it goes somewhere else, but but if you make sure you're covering all the skin, then you should be in good shape. And kids that seem like they're very prone to more burning or sweat things off, there's some preparations that have some zinc oxide in them that are going to give you some physical barrier along with the SPF protection that you might use on tops of shoulders, tops of earlobes, nose, cheeks, kinds of things, or put your sunscreen on and put zinc oxide over it.
Oh, that's a good idea. How about the colored ones, the purple? Is that just a sales?
I don't know that they make a difference, but they're basically good sun reflectors. So if it's a zinc oxide base, you should be all right.
Okay, good. How about the clothing that they make now, the sun protectant?
They're supposed to be useful, and so that's an option. There's some people that just don't tolerate the sunscreens. They have a hard time finding one they're not allergic to or sensitive to, so that's a very reasonable option. Wide brim hats. Your hats need, if they're really going to offer your face some protection, should be at least 3 inches wide on the brim.
Okay. And then I guess the next thing would be water. We touched on water there a little bit, but water safety then, kids around the pool or lakes, what your recommendations would be.
And there are lots of rules and regulations about, that pools being fenced, and I think if you're going to be visiting somewhere, you want to be sure that people follow those rules if you have especially a younger toddler or a child that doesn't know how to swim. You want a fenced-in pool, and even the above-ground pools, that's important if you have kids at an age that can climb the ladders at all. If you have the house being one side of the pool enclosure, you need alarms or to have that door locked so that a child can't get out there unexpectedly unsupervised without anybody being aware of it. I know there are pool alarms that if it's triggered, anything breaks the water, the alarms go off. Those are all important. If parents are sitting poolside and socializing and drinking, I don't think that's a good thing to have your 15 and 18-month-old running around, because they may end up in the water and nobody might notice it. Instead of using the arm floaties for the kids, if you're going to be around the water a lot with a young child that's not afraid of the water but isn't strong at swimming yet, they should probably be in an approved life jacket so that you at least know that's going to keep them upright if they do get into the water. The floaties, parents have sort of a false sense of confidence that the kids are safe in those, and they probably really aren't. And even the vests with just the rings, but they aren't approved life vests, a child could get inverted and float upside down that way. So you just have to be very cautious.
A lake where you can't really see, I for sure would have on a life jacket. Yeah, okay. Yeah. Good. Do you have any thoughts about as far as what age they should learn how to swim?
I think it varies on what their exposures are. I really encourage all families to at least have their kids learn some basic swimming, even if they're very fearful of the water, enough that if they end up in a water situation, they can maintain themselves until somebody can help them. I don't like the infant swimming programs where we're dunking faces into the water. The babies can swallow way too much pool water. They can actually end up with imbalances in their fluids and salts and end up hospitalized from that. But, like parent-baby classes where they're just in and getting used to water, that's fine as long as it's supervised, they're hanging on to the kids. And some of the kids that have those experiences will cooperate with swimming lessons at 2 and 3, and I think that's great. Others, if they're not used to working with other groups of children, unless you do private lessons, might do better to wait until 4 or 5. But I think you get a lot further beyond that. If they have fears, it's very hard to overcome them and let them feel confident with swimming.
Right, so that may help just to get used to the water. How about insect bites, mosquitoes? What are your recommendations?
Well, they're major pests certainly in the summertime. Chigger bites are a real problem, but there's not a lot of prevention except not sitting in the grass in the evenings, because even if you're wearing shorts or longer clothes, they seem to creep into places. And they're just very stubborn, itchy things, and if you need help with itching and haven't found anything that gives the child relief, to check with your doctor to see what they prefer you use. Mosquitoes, besides that certain people get significant allergic reactions and really welt up with them, do carry some forms of viruses that can cause encephalitis and other systemic diseases. So preventing mosquito bites is a reasonable and appropriate goal to have for most people. And so using insect repellents, either that have the DEET, the DEET, in about 30% concentration, or there's a newer one now, Picardin, that comes in 5 or 10%, and you just have to see which strength works best on your child. Those should only be applied once a day, though. We shouldn't use them in combination in the fixed combinations with sunscreens, because we've got to apply sunscreen more often. But there can be toxicity to the child from the insect repellent if they're getting too much of it. So you don't want to put that on again and again.
That both of them, or is that just the D?
I think actually even with the Picardin, they're recommending at the end of the day that you should bathe them and get the repellents off of them. Don't put them to bed with it on.
Okay. Well, and so if you can only put it on once a day, is there a time of day that maybe you should put it on versus
and
another
you know,
time.
part is going to be, are they going to be in an area, you know, if they're in an area that's wet, there's some standing water, that could be a mosquito risk any time of day. But it seems as if, you know, late afternoon, evening are probably our high risk times, sometimes early morning, but the kids aren't always out socializing and playing that early in the day.
Okay, so I thought here you could do 2 in 1, your insect repellent and sunscreen, but
Yeah.
no.
Yeah, unless you're going to keep then a separate sunscreen that you use for your repeat applications.
Okay.
But
That way.
yeah, you don't want to do multiple applications of the repellents.
And is there an age restriction on using the DEET or the bicardin?
You know, I tend to, again, prefer those 6 months and older. There's been a little discussion about potentially using it a little younger on on younger infants, as long as you're washing it off if they're going to a real insect-prone area. Then again, I tend to recommend more using long sleeve, long leg clothing. Put your sprays on the clothing instead of directly on the baby, although I'd still bathe them after that because it'll penetrate some from the clothing. But sometimes you can do better with that.
Okay.
I haven't gotten many reports.
Clothing. Good.
Yeah.
Okay.
Yeah. And I haven't gotten many reports about how those clip-on repellents work, whether something like that hooked onto the stroller might be useful or not. And you can get insect netting if you're going to be out taking walks in the evening and you're concerned about it. Sometimes that's a better way. I know I always get bites even through my clothes, so if I'm using repellent, I actually do put it on my clothes frequently because they just like to chew on me.
Okay, well that's a good idea. Okay, how about ticks? I know we've had a lot of ticks this year.
It's real variable. Usually during the dry periods, they haven't gotten as big because we've had such dry stretches, but we still are having some ticks now. And if you have pets that go outside, be sure you keep some kind of tick and flea repellent on them, just so they're not bringing them into the house if you can help that. We can't use that on us, and so it's important if if the kids are romping in an area that is not a groomed area, you know, tall grass, in forests, in a lot of bushes and shrubs, things like that. At the end of the day, just to do a tick check, and check their heads, check the back of the neck, look under their clothes. The ticks do bear some significant infections that can make us pretty sick, but for the most part, they have to be attached to us for at least 24 hours for us to get sick with the bacteria they carry. So if you're checking after high-risk times and making sure to remove them, then you pretty well eliminate the issues with that.
Is there any special way to remove them then?
Yeah, there's all kinds of folklore about hot cigarette, alcohol, doing all kinds of different things. Probably the safest thing to do is to go ahead and use a tweezer, but you want to get as far down on the body, as close to the head of the tick as you can, not do excessive squeezing, and you just gently pull straight out. It'll straighten out their little tines and get them out of there.
Yeah.
You don't want to squeeze on the body
out.
because you're more likely to inject the bacteria they carry by doing that.
Okay, good. How about poison ivy, poison oak?
Yeah, and those are going to be, we see those frequently in the summertime, especially when kids are at some of our, the state parks and stuff where it's more foresty, things aren't groomed. It's very important to try, if the kids are old enough, and for us as adults, to know what the plants look like. Because if you can just plain avoid them, that's great. Not everybody that's in contact with those plants is allergic to them, so actually not everybody reacts to it, but we think about half of people will. And it's the oils on the plants that cause the reaction that can develop within a day, or it might be 3 or 4 days after an exposure before you start getting the red raised streaks, the blisters, the oozing. It's intensely itching and it burns, and it's pretty miserable stuff. If you're aware you've been in touch with those plants before you have symptoms, it's important to just as aggressively soap and wash it off as you can, because it decreases the chance that you're going to have that reaction. There are some products available now when you develop the rash that help remove the oils from the skin. One is called Zanfel, and I think there are others available now that you apply and then wash off that help remove those oils. Because a lot of kids will get into some poison ivy. They might have it on one spot. It starts itching. They scratch. Everywhere they scratch, they spread the oil, and it spreads the reaction. And so those kinds of products do really help sometimes get those oils off, get the itch a little better under control. And sometimes you need oral antihistamines to control itching, or topical steroids.
So when you say oral antihistamines, which
I
ones are
most
you
often
talking about
use
there?
loratadine or Claritin or generic Zyrtec. They work
Okay.
pretty well. Benadryl used to be the old, we used it all the time, and so many kids have either hyper reactions or sleepy reactions from it, and I feel they have fewer reactions to the others.
Okay, sounds
So
good.
those will help sometime, and sometimes your own physician would be able to give guidance about preferences that they might have.
And again, if you're in an area that you know you might have poison ivy or poison oak, long sleeve shirts,
Absolutely.
pants,
Long
and-
pants,
yeah.
those kinds of things really help make a difference.
Okay. How about bicycle safety or
Mm-hmm.
vehicle safety?
Well, I guess as we talk about heat-related things, just reminders that if children are sitting in a closed car while you're very quickly running in to run an errand, the temperatures in those cars, especially in the weather we're having currently, can get into the hundreds of degrees very rapidly and can really, in an infant, can be fatal. And even in toddlers can make them extremely sick. So, just don't do it. And
So
cracking
never-
windows doesn't
Never
help.
leave your child, toddler, infant in a car
In a
by
car,
themselves.
right.
Okay. And matter of fact, I think it might even be against the law to do
It
that.
actually
but-
is,
Yeah,
yes.
Okay.
Yeah. But then in terms, the nice weather, the kids are out biking, rollerblading, using skateboards, all that. Scooters are more and more common these days. And I really strongly recommend that the kids wear helmets with all those wheeled activities and even those Healy wheels. Those are kind of dangerous. But anyway, if they're going to use the wheels on those, they should have a helmet on their head. And the philosophy being that doctors can fix broken bones pretty well. We can take care of scrapes. We don't fix broken brains. And all of these fast-moving things, if a child comes to a sudden stop, if a car isn't paying attention to them and hits them and they go flying, their heads are relatively big parts of their body. They lead with their heads. And they're prone to have a brain injury if we don't have a helmet on. We can replace that broken helmet. We can't make sure that that brain recovers and gives us the child we had before the accident.
Right. If you've had a hard impact with a helmet, can you use that helmet again?
Actually, it would be very much just like with car seats. If you've been in an accident with it, get a new one because you're not sure it's going to respond appropriately to the stresses next time.
Okay.
And then the elbow and knee guards and those kinds of things for the boarders and the skaters and stuff are never bad protection.
Yeah, okay. And we have 4th of July around the corner. And any tips there as far as fireworks and safety?
Yeah, I really strongly recommend that families go to professional shows and let the professionals handle the fireworks. Even sparklers and the little sidewalk worms, kids can get burns off of them. And there are very, very frequent accidents with even sparklers. The sparklers are extremely hot. 20% of the accidents in kids with fireworks are eye injuries, which can mean loss of vision in an eye. And so to really be safe, the smart thing is, hey, let's go watch the people that do the great up in the air shows and let's not risk our kids having problems with doing them at home.
If kids do fireworks, do you have an age that you would say, or you just say no?
Yeah. I think it's pretty tough. I think your teenagers, you can try to set standards about what's safe and how you do things. Some of the fireworks you do misfire and cause problems. Kids playing with sparklers like to run and play and stuff, and they're going to trip and fall sometimes. We have kids end up with sparklers in their shoes.
Okay.
So,
Well,
I'm a big prevention person, I guess.
Okay, well, I agree with you there. So, and I think you wanted to mention something about lawnmowers. Is there a safe age that kids can be mowing?
Yeah, there really are some pretty strong guidelines for that. And for the rider mowers, they're actually suggesting that children that aren't of age to drive yet should not be driving rider mowers, partly because of coordination skills and abilities and just physical size to reach the machinery that works the mower. 16 or over to do a rider mower. A push-behind mower, it's really recommended they be at least 12.
Okay.
And if dad is riding around on his lawn tractor, we recommend that he not have a toddler or a younger child on his lap or anything like that. It's just too easy to have a tumble or a fall. And to be sure the kids are clear of the area, because when we're watching for things when we're mowing. We're not always expecting a child to run right across our path, or
Yeah.
and that the kids need to be aware that, hey,
How about
I don't want
protecting
to.
their ears when they're mowing?
And they do
too?
recommend
Yeah.
wearing ear protectors and actually eye protectors if they're, especially a walk behind mower, if there's any debris in the lawn. You can prevent a lot of that trouble by scouting where you're mowing before
probably
you start
all of us should be
mowing.
doing,
Yeah,
yes. Okay.
but if there's some flying debris, some eye protection isn't a bad idea.
Okay. Well, thank you very much, Dr. Bleicher, for joining us today.
You're welcome.
This is Talks with Docs, and we'll see you next time.